Now, how to calculate? There's no simple mathematics. When you think about metabolic surgery, the cost is so many options, so many criteria you need to calculate, you need to take into account. The procedure itself, hospitalization, whether the patient develop a perioperative complication, rebound in weight or reappearance of the complication, whatever. If you don't treat with surgery, you need to treat obesity like with just Professor Ian Catterton just now, life, diet, exercise, or drugs. If it's going to last for your whole life, how much is that? If you -2, we'll take the difference, and how much desired outcome you have. And can we measure that by calling the unit that I just mentioned? Now, these are the components that I just mentioned. For your information, direct cost means the exact amount of money used to treating the disease, but indirect cost means how much the society lost when you're absent from work, that you need to take time for treatment of the disease. And itself is also another area is because you need to treatment, you need to buy some more instrument. Now, this is the literature review, one largest recently published paper, a systemic literature review about the world expenses on obesity. I want to find out for a number. Is that expensive? I mean, the expenses for obesity, it cannot give me, unfortunately, there's no such answer. Different country has different costs. United States, obviously, a lot of publications, also Brazil, Mexico, and Thailand, Sweden. The conclusion of this paper is obesity is, like Australia, is causing a lot of healthcare expenses, and we need to prevent or treat obesity as soon as we can, and it's a matter of time that we need to tackle with that. The cause of obesity in Hong Kong, this is the only paper that I found. It's published 10 years ago. 5% population at that time already is consuming drugs for obesity and related conditions, and which around 10% of the healthcare expenditures on health, and around 20% is attributed to obesity and related disease. Now, this figure, let's take a look. Report from Department of Health from Hong Kong. Obesity prevalence from 2013 and 2018. I didn't actually, when I walked to the street, I didn't actually notice so much drastic increase in percentage population. I don't know if they changed the definition of BMI or not, but this is the figure released. Take BMI of more than 23 or above. Half of population is actually overweight. If you're not more than 25, you're not called obese. But then haven't count into, obesity is increased mortality, affect your quality of life, and also increase the healthcare costs. If you count the amount of money or the expenses related to diabetes, this is the paper, and only one paper published in Hong Kong, MJ. About 2 billion, half is related to obesity and overweight for diabetic patients, okay? Each person's on average more than 237,000 for their whole life for diabetes alone. You haven't taken into account, if you're overweight, but a diabetes, this is additional amount you have to, for the expenses, and haven't count all these, hypertension, OSA, stroke, heart disease, and indirect costs. So you can imagine what is the cost like. So now, cost of obesity, again, these are the published paper for surgical procedure. Different country, the healthcare cost and the surgical procedure is different. So again, a lot of publication from United States, the prices, of course, is different. US dollars is very expensive. When you take the example, now this is already some time ago, also take into account the rise in the medical expenses and also medical instrument. This is a special formula. Don't ask me the details. I know the formula, but it's very complicated. I asked the administration from our operation theater in charge, and also to calculate the manpower, surgical instrument, the time, the consumable and non-consumable instruments. This is the price for a sleeve gastrectomy, about 68,000, and relatively cheap when compared to United States, and worldwide bypass. For your information, in private sector in Hong Kong, it's about 150,000 to 200,000 per sleeve gastrectomy. This take into account for OT staff, instrument, consumable, and hospitals. They not yet account for the complication, reoperation, and the recurrence of the complication.